Ever feel like you just can't get going, no matter how hard you try? What if that laziness is actually your mind and body trying to tell you something deeper? Today, we're exploring the subtle but significant differences between everyday fatigue and the warning signs of depression. Before we begin, a crucial disclaimer: the signs discussed here are not for self-diagnosis. If you or someone you care about is struggling, please reach out to a mental health professional. They are the best resource for proper assessment and support. We all have those days when motivation seems to vanish and staying in bed feels like the only option. It's normal to feel uninspired or lazy sometimes, especially in our fast-paced world. We're constantly pushed to be productive, which can make us feel guilty for any downtime. But what if those persistent feelings are more than just a temporary slump or burnout? What if your laziness is a signal of something more profound? It's vital to understand the distinction, not to label ourselves, but to seek the right kind of support when needed. A common feeling of laziness often comes from stress or overwork. We can usually find ways to shake it off, like making a to-do list or setting small, achievable goals. But depression is different. It's not a choice or something you can simply snap out of. Depression is a serious mental illness that requires professional care, which might include therapy or medication. It's important to remember that depressive episodes can recur, and long-term support may be necessary to help you cope and heal. Be kind to yourself and understand this isn't a personal failing. Do you often struggle with unexplained sadness, loneliness, or a pervasive sense of hopelessness? You might feel exhausted all the time, with little to no energy, even after rest. Nothing seems to lift your spirits, no matter how hard you try. Comfort food, self-care, or even fun times with friends don't seem to brighten your mood. When battling depression, even activities you once loved or spending time with loved ones might not bring joy. This persistent inability to feel better is a key indicator. According to the American Psychological Association, a significant loss of interest or pleasure in activities is a hallmark of a depressive episode. If your laziness has led to a widespread lack of motivation, affecting your work, school, or hobbies, it's a serious sign. With depression, you might withdraw from social interactions and prefer to stay home, doing nothing. It feels like you just can't find the energy or desire to care about much anymore. This profound disinterest goes beyond typical boredom or fatigue. Is your laziness getting out of hand, making it difficult to manage daily tasks? Has it started to interfere significantly with your work, school, or personal life? If you answered yes, you might be experiencing depression. Psychologists often look at the 4 Ds of abnormality: deviance, distress, danger, and dysfunction. If your current state is causing significant dysfunction and feels like a constant hurdle, it's a strong signal to seek professional help. Your ability to function is a critical measure. Laziness often manifests as procrastination and can be linked to specific reasons, like low self-esteem or a lack of discipline. We can often pinpoint why we feel unmotivated. However, depression doesn't always have a clear, identifiable trigger. The truth is, psychologists don't always know the exact cause of depression, and it's rarely just one thing. If you find yourself feeling profoundly down, disheartened, and unenergetic without any obvious reason, depression might be at play. It can appear suddenly and without warning. Finally, and perhaps most importantly, the key difference between laziness and depression is choice. While you can often choose to overcome laziness by resting or trying productivity hacks, depression isn't something you can simply get out of. When you have depression, you are not choosing to be depressed or to stay that way. In fact, many individuals with depression report intense feelings of guilt, shame, and helplessness. Mental illness is complex and goes far deeper than a simple lack of effort. Can you relate to any of these signs? If you or anyone you know is experiencing persistent feelings that resonate with these descriptions, please don't hesitate to reach out to a mental health care professional. You deserve support and understanding. Please like and share this video if it helped you, and consider sharing it with someone who might need to hear this message. The studies and references used are listed in the description below. Don't forget to hit the subscribe button for more supportive content. Thank you for watching, and we'll see you next time.